Stress and depression, maximizing treatments abstract effectively detecting and addressing individuals along with anxiousness, depression, or both is a difficult aspect of engaging in medicine and the key treatment collection. For that, we advise that you take into consideration psychological health relevant information prepared by the NIAA's Office of Mediation Guidelines and Training, which is a foundational component of scientific technique and supplies assistance and patient-centered management strategies. Mental health and wellness information is required for usage through persons for whom the general specialist is not currently authorized. Clients often provide with somatic grievances instead than traditional psychological signs. Many have been identified with depression and are looked at a feasible indication of somatic, psychological, and bodily symptoms related to the oppressive incident. It is likewise suggested that clients may possess consistent non-monotonic and in-season mental signs. For individuals who do not show actual, mental or physical features, drugs should be regularly utilized. Clients along with substantial comorbid health conditions should receive regular screening to confirm the severity of their signs and symptoms. In add-on, there is actually substantial overlap between anxiety and clinical depression in this patient populace. The principal difference between stress and depression is that these clients possess extreme clinical depression and hence might possess higher than normal prices of symptoms. This is usually the instance in clients along with mental illness, but may not be the scenario in these individuals. This reality proposes that depression on the part of those suffering from anxiety might also predispose them to anxiety. Comorbid anxiety and depression is usually extra resistant to pharmacologic therapy, and clients with coexisting problems possess a low-grade healthcare outlook than do patients with either condition alone. The usage of dental contraceptives such as birth management, antihypertensive drugs, or other medicines such as estrogen is not an isolated scenario of the unplanned pregnancies developing in pregnancy. It likewise does not seem that oral birth controls may be much more efficient than substitutes for stopping or treating impotence in the future. Fortunately, a lot of brand new therapies are readily available to support the clinician in taking care of these individuals. The brand new drug may be the very most effective at easing anxiousness or also assist ease the distress of the head soreness. The second procedure to be examined is a light cognitive booster, the procedure that are going to consist of a focus on cognitive functionality after being taken. This is the very most effective drug for fixing an assortment of disorders, including short-tempered digestive tract syndrome and depression. The newer antidepressants, in particular, are playing a significantly necessary role in the procedure of both stress conditions alone and comorbid anxiousness and clinical depression. These drugs are being created for the treatment of extra-particular and often extra-typical kinds of depression, such as depression-related intellectual decline, interest complications, and obsessive-compulsive condition. Their efficiency remains to be shown, and this approach is being checked to build brand new substitutes to the typical antidepressants. These new selections allow our objective of therapy to include not only renovation but additionally sustained total remission. This does not indicate that it will be all treatments we undergo. Nevertheless, the end result is not, however, well documented. So what we are appearing for is that interferences that lower the requirement to seek or possess accessibility to drug, inpatient or outpatient, for some, or all, of these severe situations.